Good morning, good afternoon, good evening, depending on where you are in the world. Welcome and happy World Kidney Cancer Day. I'm Dr. Mahdi Sheikh, scientist at the International Agency for Research on Cancer, which is the World Health Organization's cancer agency. I'll be your host today for International Kidney Cancer Coalition Global Patient and Carer Symposium, Living with Kidney Cancer. Regardless of your age and stage, when you are diagnosed with kidney cancer, the main challenge you may face is how to maintain your quality of life, how to maintain your physical and mental well being when this diagnosis, cancer diagnosis, has turned your whole life upside down, and how to find the reliable sources or support groups and all these things that I would like to talk about in the next hour with our fabulous panel members of two patients with kidney cancer who have gone through this journey, one care provider, and also two healthcare professionals. So, I would like to introduce our fabulous panel members. Joel Stern is a patient with renal cell carcinoma from the United States who's extremely active in his patient support group and has even written a book featuring many of the entertaining and inspirational posts that he has shared with his groups about his own cancer journey. Dr. Christian Bergerot from Brazil is a psycho-oncologist with over 15 years of experience in working with cancer in cancer care settings and an expert in people's experiences of cancer and quality of life beyond medical treatment. Claudia Ungarelli from Italy will bring us a carer's perspective. Claudia is care for her father, and Claudia is also a volunteer at International Kidney Cancers Coalition, Italian affiliate organization. Francesca Maglione is an oncology dietitian from New York, so I'm sure we'll have a lot to bring to our discussion on diet and nutrition when living with kidney cancer. And Steve Pointon is a patient with renal cell carcinoma from the United Kingdom whose treatment story includes some intense time on interleukin, who has had some positive experience with counseling and support groups. And Steve has now trained as a counselor himself and is helping others through their cancer journey. Welcome, everyone, and thank you very much for accepting our invitation and joining us. So, to start the symposium, first, I would like to start with the beginning of the cancer journey. When you first receive a diagnosis of cancer, you may feel, the stress and anxiety, and I would like to talk about that experience, how you felt, and also, did you share it the story afterwards with your family, with your friends, and how did you find that? Was it difficult? Sometimes, we're worried about worrying other people might bring some stress to their lives. Are there something that you want to tell people who go through this journey for the first time? So maybe we can start with Joel.
Thank you, Mahdi. November 18th, 2020 is a day that will live in infamy in my family. I had bad back problems for a while. I was just sure it was old man's back problems and nothing else. I went to an orthopedic surgeon and had scans, and I got a phone call on Monday afternoon. And basically the doctor told me that you have what is very suspicious to be metastatic cancer. After a lot of other scans and blood work and examinations, they diagnosed me as having stage 4 renal cell carcinoma with a little kidney tumor that really was causing no harm except spreading up and down my bones from the top of my skull to the bottom of my hip, with a 9-centimeter tumor in my iliac that was destroying my iliac bone and causing all the pain. To be candid, I was in complete shock and denial when I first heard the diagnosis. And then very quickly, I got very angry. And soon after, I got very sad. There was no hiding it from my immediate family of a wife and 3 daughters, because I had totally changed from the happy-go-lucky person to an extremely despondent person at first. And fortunately, what I call Team Stern, my family was extremely supportive. But other than my immediate family, I was not ready to tell anybody. As a matter of fact, I basically laid on a couch for several months and wallowed in my self-pity until I got to the stage of cancer that fortunately I'm still in right now, which is I'm going to beat the you-know-what out of my stage 4 renal cell carcinoma.
Thank you very much, Joel, for sharing this with us. And now we heard from a patient who has gone through that experience. Also, it is not just a shocking experience for person who has this diagnosis, but also for people who care about him. I mean, family members and carers. So I would like to ask you, Claudia, about your experience, as a carer or as a family member of a patient who received this diagnosis. So I want to ask about, how you felt as a carer, and also, how did your father share this story with you? Was it easy for him? And yeah, please.
Thank you, Mari. So, generally speaking, in Italy, there are challenges when discussing cancer with family members, especially.
Mm-hmm.
Patients in general, they don't want to speak with the family in order not to burden them. And when my father were first diagnosed with stage 4, my parents considered not telling me because they thought that that would be too much for me to handle, even though I was 30 years old and not a child anymore. However, as a daughter and now a caregiver and advocate for my father, I have been a great source of support for him and my mother, because from our experience, dealing with cancer requires research, organization, and advocacy, which can be overwhelming for a patient already dealing with the emotional impact of his illness. So eventually, my father decided to choose to be open about his diagnosis, not only with his friends, but also with his family. And it definitely was crucial for him. It allowed him to receive psychological support from us, and it also enabled us, as his family, and me especially as his daughter, to assist him on an organizational level. So therefore, sharing his experience with us, sharing his diagnosis, was definitely vital for him.
Thank you very much. And now I want to ask Steve about your experience. So Claudia talked about some cultural aspects in Italy about sharing this story. So, and we all heard of the classic British Reserve and this cultural point. So I want to ask you about how was that for you, and how did you feel, and how did you share that with your family members and other people?
Yeah, thanks, Maddie. Yeah, it's very similar, really. As I was diagnosed twice. The first time I was in a hospital room on my own, and I got told very bluntly, and I had to make phone calls home to the family. The diagnosis was on the back of a lot of other checks, and they didn't really know what they were looking for, and they found my tumor purely by accident. So I was as much shocked. I wasn't expecting a cancer diagnosis. So that call, or them calls to family, were really, really difficult. And beyond the family, it was almost impossible for me to start with, because I came from a security background and a senior manager background. So I had 200 members of staff reporting into me. So one thing I couldn't afford to show was any kind of weakness. And the same in my other line of work, working on pubs and clubs as a door supervisor. Weakness would be make you eaten alive in that kind of industry. So I was very used to keeping things very close to my chest. And it wasn't until I learned other ways that I was able to talk as freely as I do now about it.
Thank you very much, Steve. We have a question here from a patient. So Claudia touched about some issues about speaking with children. Well, she was 30 year old, and here we have a question saying that I have recently been diagnosed with stage 4 renal cell carcinoma. I want to be honest with my teenage daughter, but she suffers from anxiety, and I'm worried that telling her about my cancer will increase her anxiety, which will also increase mine. Can the panel offer any advice? And here I would like to ask for your advice, Chris. In addition to advice for that about how to speak to children, what to do that. Also, as a psycho-oncologist, I would like to ask, are there any guidelines or studies that showing that, if you speak about your diagnosis, that would be beneficial for your health, or what should you speak about and what you shouldn't tell people who are around you about this diagnosis?
Hi, Madi. So yeah, sure. I think for the first question, I would definitely consider our child age and also the emotional maturity that this child has, and the ability to understand the concept of cancer, of treatment, and also of prognosis before disclosing such information. But involving family and friends can also facilitate shared decision making. So by being open with them can allow for a more open and supportive environment. So I will definitely recommend this to all of you. I will just try to take care the way that you will prefer to receive this support and also this help.
Thank you very much. But another thing you can do is to share your story or share your concerns or talk about this diagnosis and this disease with those who have already been through this journey. So about you might experience some side effects, some you might have some questions, and you need some information from people who have gone through that path. So you may ask, is it only me? Is it something common? And all these topics. So I would like to ask Steve and Joel, as I know you have been very active in these patient support groups and you're actively participating. So I wanted to ask, first of all, how did you find a patient support group, and then how it's been useful for you? Was it a good experience? Was it is it something that you recommend to other people to do? And also, how does it differ from sharing the experience with family members? Are there new things or new perspectives to bring in? Probably so. Steve, may I start with you?
Yeah, I've got two experiences in that, one good and one bad. In terms of my first time I was diagnosed, I didn't have any contact with a patient support group in any way. And to be honest, it never crossed my mind to look for one. However, when I was diagnosed with metastasis into my lymph nodes, one of the first things I did was look for some patient support. And that proved to be absolutely invaluable for me, because there are things we can tell our family. We can talk about facts. We can talk about what the consultant says. But they're dealing with, as Claudia said before, they are dealing with enough as carers and family members watching you go through this. And I can only assume they feel powerless to be able to control or help. So having somewhere that's private, secure, and with other people who've gone through or going through the same is really, really important and was valuable to me beyond belief. I went through a very specific and unique treatment, and my consultant told me, you don't have to do it. It is that toxic and that brutal. Some people choose not to do it. That scared the living daylights out of me. However, once I got onto the patient support group and spoke to patients who'd been through the treatment, I realized, yes, it is as brutal and as toxic as the consultant said. However, it's doable. It's worth going through it for the potential returns. And you do recover reasonably quickly afterwards. There are some side effects, which then you can discuss ongoing with the patients that have been through it as well. What helped them? What didn't help them? So I am a fully paid up member of patient support groups. I now help out with the UK version. And I would always recommend it, but make sure do your homework. It's a safe, secure, private support group.
Great. Thank you very much, Steve. Joel, again, like patient support groups, I know you're very active there. So can you please tell us more about that, about your experience, and do you recommend that?
Sure, Madi. From day one, as I said, I had Team Stern, and that was my family, and that was all that I had. And while they were extremely empathetic to what I was dealing with, they loved me unconditionally, They really didn't understand what I was going through as a patient with stage 4 renal cell carcinoma. And there was a void in me dealing with this disease. So I had them, I had my doctors, and I had the internet. What I didn't have is a community of people that were going through a very similar disease to talk about the disease itself, the side effects, how to deal with both the physical and mental issues that we all have to deal with, how to best utilize caregivers. So I was one of the last of the baby boomer age to get onto Facebook, but I joined Facebook after my diagnosis, and I started playing around with it. And I found several communities, many of which were private. And I think being private is very important. So what we say in that group is confidential. And I found groups of people that not only had kidney cancer, but they had either the precise type of kidney cancer I had or the same stage. And it was a global group. And they were there for two reasons. Number one, to help themselves, but number two, to help others. And to share the success stories that despite having this very serious disease, there's no reason why we can't keep on living with this disease. So I very quickly got addicted to a few stage 4 renal cell carcinoma Facebook communities. And I found it not only cathartic for me, but I believe hopefully cathartic for others. And as I've told many people, while I love my medical team, that's one doctor in Chicago, Illinois, or maybe another doctor in Texas. What we have in this community is doctors around the globe and palliative care around the globe. And we share these stories about what works and what doesn't work and what's good from a nutritional perspective and what's not so good and how to deal with some of these issues that are foreign to even the best doctors in our cities. And by sharing these stories, we're able to go back to our own doctors and help educate them, and they learn from all of us. So you asked me, do I recommend Facebook communities and other similar type communities to be part of a community of commonality in dealing with this disease? The answer is 100% yes. I hope I've gotten as much as I've been able to give to others, and look forward to continuing to learn from other people that are dealing with this disease.
Thank you very much, Joel. Interesting points you mentioned, very important ones. Francesca, I know you've worked with patients with cancer, and you've seen a lot of this type of patients. So I want to ask, what do you think in this regard if the patients join, and also, as in your expertise and in your experience, when we care or when we provide healthcare to patients with cancer, is there a good setting also for showing them the patient support groups or for sending them to patient support groups? Is there anything we can do better as healthcare professionals?
Yeah, thank you, Maddie. So I just want to say I appreciate the input from everybody so far, and I agree with what everyone has said. I am a strong believer in the power of support groups as well for my patients and caregivers of patients. And sometimes I recommend patients to join support groups, whether virtual, Facebook, or in person all the time. And I have also participated in support groups and spoke at support groups. And I think that as healthcare professionals, sometimes I realize that there's a gap that I can't fill for a patient and their family can't fill. And that's when I can see, I'm like, okay, you need to talk to other people who are in this situation. I can have compassion and empathy, but I'm not going to pretend that I know what it's like to be in your shoes. And I think as healthcare professionals, the best thing we can do for our patients sometimes is to admit that and direct them to have that community and know that there's power there, and know that we can't do everything for them all the time. And a lot of the times with nutrition, I've had my patients take my advice, share it with their support group, and vice versa. Sometimes they'll take something they heard at a support group and then bounce it back off me, and then we could talk about it. And so I've learned stuff from my patients through support groups, and I know that stuff that I'm teaching my patients gets disseminated and shared into support groups as well. And people have a lot of different levels of medical care and access to medical care. And a support group is a great way to get access to knowledge and care that you might not have access to if you don't have health insurance or high quality health insurance. You still might get access to what someone else is learning from a team, like a really comprehensive team. So I think we need to really utilize it as healthcare providers.
Great, thank you very much. Fascinating. The ideas, from both sides, from a healthcare provider and also from a carer and also from patients, and how important it is. We share knowledge, and we see the very good effect of the support groups across different countries. So we have a question here from a caregiver asking, my wife has kidney cancer and I would like to join a patient support group. I've been looking online for her, but I'm concerned that she might find herself in a group that is promising a miracle cure or is a scam trying to get money out of vulnerable people. How can I check that a group is legitimate and has good intentions? So I think this is a very, very important point. Now we've talked about all the good side, all the good things, but also there are these, scam groups or unfortunately some unlegitimate groups. And I want to ask first, Joel, what do you think about, how to find a reliable support group? And then I will comment on that.
Sure,
Joel, please.
it's a great question. That the last thing that any of us want to see is somebody get out of a group that is not working in their best interest. Number one, talk to your hospital, your medical team, and that can include your nutritionist, your therapist, your oncologist, the nurses. They're going to know people, or they're going to know people who know people that are participating in groups that they think are going to be good for you. Number two is develop a network of other people like us who have stage 4 renal cell, either as a patient or as a caregiver, and we're all happy to share. And hopefully there's the ability to get in touch with any of us, because we're happy to share with you our global Facebook communities that we find to be the most worthwhile. Number three, you can go to organizations like the great organization that's hosting the session and ask them for some examples. The two caveats I would give is, number one, look for a private group, because again, what you want to make sure is that what is said on those sites is private. I know somebody who is extremely active on a stage 4 cancer site, but on her regular Facebook community, she hasn't told a soul. And that's totally her call. And she's very confident in knowing that what she says on this private site will never be conveyed in the public domain. And number two, understand that even if you're on a private site or on a site that you like, there are scammers. There are people that are always trying to take advantage of others and get a buck. And the best advice I would give you is, if it sounds too good to be true, it most likely isn't. And anybody that's selling miracle cures on a legitimate site, tell the administrators and we will kick them off. And I've had to do that as an administrator on some of the sites that I manage, but we will help manage that for you, and we're all here for you.
Great, thank you very much, Joel. Very, very important aspects. So just I would like to add that, if you find a group online or some support groups or patient groups or whatever you find online, and then you want to check if this is legitimate or if this is reliable, one of the sources that you can use is to ask the International Kidney Cancer Coalition to do it for you. So on the World Kidney Cancer Day's website, there is a downloadable PDF on social support that has all these details and can guide you through how to do that. So I would like to ask Francesca, as a special oncology nutritionist, besides the general advice that we give to people about eating healthy, healthy diet and all these facts, are there certain things that you would advise to patients with kidney cancer to do, at different stages of their disease, or at the beginning or at the time of surgery and these stages? So I would love to hear more about that if possible, Francesca.
Sure, thank you. And just to start by echoing what Joel said, if it sounds too good to be true, it likely is. A lot of the times people want a miracle cure, a superfood, and it's just not that simple. But I like to tell my patients it's simple in another way. It's simple in that you need to nourish your body. You need to stay hydrated. You need to, most of the time, a good piece of advice that applies to a lot of people in a lot of different phases of their treatment is eat small amounts of food, keep your fiber intake up, which means eating fruits, vegetables, beans, legumes, pulses, whole grains, oats, brown rice, um, seeds, nuts, these kind of foods. It could be easy to get on the internet and see information for chronic kidney disease and think that it applies to kidney cancer, and it's not always a direct application to kidney cancer. There are some things that I would limit. Added sugar is not great to have in abundance, but at the end of the day, if you're not feeling well and you want some ginger ale or Coca-Cola or some ice cream, absolutely have it, enjoy it. And then I think there's cultural aspects too. A lot of people come to me and think, oh, I have to give up this food that's part of my culture or this food that I love. And that's not true at all. You do not have to sacrifice your comfort foods, your cultural foods to eat healthy. And I think something that kind of ties this all together is that A, it's very individualized, and B, what we're kind of talking about with like the psychosocial aspects of cancer is that how we feel about how we eat makes a big difference in how our body digests, absorbs food. And if we're having this added stress, there's already a lot of stress around this diagnosis. And when we add this stress around eating, it affects our gut. It actually impacts the way that our gut handles food. It affects our microbiome, which can change the way that we are getting like anti-inflammatory benefits from food and all these benefits that the microbiome give us. So I always tell people too is like relax, enjoy, do some deep breathing. Really, like I like to tell people like do a happy dance when you're eating. Like it's actually going to help you. Food brings us so much joy, and it is one of the things I hate to see the most is when people lose that joy with food because they're so stressed about what to eat. So there's definitely the simple aspect. Eat the good stuff, eat the fresh stuff, eat what's in season, eat your comfort food, eat what you love, tie it all together. You're your own person, eat what feels good, enjoy it. And, if you have access to someone who could, like me, who can help you kind of like work through where you're at on a week to week, month to month basis, that's amazing. If not, once again, these support groups are a great way to get more information. And then same thing, resources like the International Kidney Coalition is another place. They have an amazing booklet on nutrition with menus and recipes and all kinds of great stuff there as well.
Great, thanks, Francesca. Very important point you mentioned. It's really not only the physical and the nutrition part of the food, but also the psychosocial and the importance of it for mental well-being and how emotional it is important to sit with the family members and have food together. So talking about that. And we have a panel member from Italy with a fabulous Italian food. So, Claudia, I would like to ask about, when your father was diagnosed with cancer, did it affect, was he making any changes to his nutrition, to his diet, and also did it affect the way you sit together and eat food together? And I would like to hear more about your experience with that, Claudia, if possible.
Thank you, Maddie. So yes, food indeed is very ingrained in Italian identity and is very much an activity shared with friends and family very often, if not regularly. In the case of my father, when it came to his dietary choices, he didn't have to give up on his favorite food because we have been told by the nutritionist that we consulted that the Mediterranean diet, which is already part of our cultural culinary habits, it's good for its preventive benefits against complications related to oncologic diseases. So the only adjustment he had to do was to reduce his sugar intake because he loves his desserts. But that's about it.
Thank you very much, Claudia. We have a question from a patient. talking about losing the appetite and not being able to eat or to think about food when going through some of the therapies and some of the treatments. And this is something that we observe sometimes with patients. So I think it is better to listen to the experience. We have Steve here, who was on interleukin treatment, as he said, and I think that has some side effects on the on the appetite and on eating. So Steve, can you please share some of your experience in this regard, and how did you do?
Absolutely. I mean, before I got to interleukin, after my nephrectomy, I was told, live a normal life as possible. As Francesca said, keep hydrated, and remember, you only have one kidney, so don't do anything silly. You haven't got that insurance policy, was basically what I was told. But enjoy life, get on with it, and just be careful. But more specifically with interleukin, I mentioned the word brutal before. It is an absolutely brutal treatment. And I was told, go with how you feel while you're on the treatment. And then once you finish the cycle, build back up to what you feel like and take what your body needs, because the medical team will look after the nutrients you need when they're constantly checking your bloods and all your other ops and things like that. They will put what needs to go into your body. And to be honest, each time I went into hospital for a cycle of treatment, I didn't eat anything for 5 days at all, because that is just what my body felt like at that time. If I'd have force-fed myself, I don't think I'd have got through the treatment as I did. I just went with keeping hydrated. I drank a lot. I did feel like I needed to drink a lot, but food-wise, didn't eat anything. But pretty quickly after the treatment, as I came home, your appetite starts to rebuild. And yeah, it's one of them. I'd say to anybody who's going through the treatment, really, take your bare minimum that you need nutritional wise, but go with how you feel.
Thank you, Steve. Francesca, can I come back to you asking about your advice in this regard? We know that some of these treatments have these side effects during the treatment time. And do you have any specific advice for patients who go through this phase?
Yeah, of course. So what Steve said is totally correct. And a lot of people could get really scared by that if they're not eating so well for those short periods of time. But there are some tips that can help get a little bit more in. So one is small, frequent meals. So just trying to eat small amounts more often throughout the day. The second one is very helpful, is drink your calories, drink your nutrients. Our body recognizes solid food a lot quicker than liquids. And so a lot of the times I'll ask my patients, are you still able to drink water? And they'll say, oh, yes, I could drink water. And I'll say, okay, well, let's lean into that. And let's do some smoothies or milkshakes or juices or cereal and milk, hot cereals, porridge. Lean into those really easy foods that you don't have to spend a lot of time chewing. Because when you don't feel like eating, the last thing you want is food in your mouth for a long time. You just want to get it down. Use a straw, put a lid on it, whatever you have to do to just get it in easily. Those are kind of my two big tips. And then the third one is whatever comes to your mind, go for it. Because when you don't have an appetite, if something comes to you, the idea of a donut or the idea of a slice of pizza, even if it feels like something that shouldn't work, usually if it's coming to you and it's a craving, go for it and it's going to work. So that's kind of that third piece of like individualization of listening to your body.
Thank you very much, Francesca. Great advice. I have another question here from a patient saying that I have been told to both give up smoking and to avoid stress. I know from experience that giving up smoking will be very stressful for me. Is there a point at which the stress of giving up long-held habits like smoking and drinking outweighs the benefits? So this is a very important question about when we say lifestyle modifications and lifestyle factor, smoking and drinking is part of that. So I would like to speak about the studies that we have done in the past 2 decades, I would say. So we all know that smoking and drinking, are two risk factors that increase the risk of getting different types of cancer. And if you quit smoking before that, so your risk becomes lower. But the question is that we know unfortunately, many people who smoke at the time of diagnosis, they still keep smoking. When they develop cancer, they still keep smoking. And then we have the stress from cancer. And then these people feel hopeless. They think that there is no point. And even, unfortunately, some of the physicians, the same, think that there is no point of quitting smoking at this time. So we did some studies in the past two decades on different cancer types. And we recruited, for example, 500 patients with lung cancer, more than 200 patients with kidney cancer, and we followed them for more than a decade. And importantly, we saw that patients who smoke at the time of diagnosis, if they quit smoking after that, they can hugely reduce their risk of poor cancer outcomes, including like mortality, including recurrence of cancer, including the response to treatment, and all these important aspects. So, and the effect we saw was, it cut the risk of these poor outcomes by half. So it is a very, very big thing. And unfortunately, seeing the different studies that we see, only 40% of patients with cancer who smoke are advised even or supported by their physicians to quit smoking. So I would like to emphasize that the effects that we saw that people could benefit from quitting smoking, it is really not just for those who are light smokers or with early stage. No, we could see that across all stages of the disease, even if it is stage 4, they benefit from quitting smoking. They live longer in remission. Like, for example, for lung cancer, it was 2 years. For kidney cancer, more than 3 years without the recurrence of their disease. So the effect is very important, and across all stages, as I said, and even heavy smokers. So what I would like to really tell patients with cancer who smoke, it is never too late to quit smoking. I know you might feel helpless or hopeless, but no, really it is very, very beneficial to quit smoking. So just for interest, because we have different audience, from caregivers, from healthcare professionals, I would like to mention here a reference. It is WHO Tobacco Knowledge Summaries, and it is available online, and the link that my colleagues will show. So it helps you to understand the evidence that and how this might help. And in this evidence summary, it stresses the important limitations that we currently have in clinical practice, and also it is for patients and caregivers. So please read that to know how you would benefit from quitting smoking. Now, I would like to. You mentioned physical activity here and doing physical activity, and physical activity is a part of lifestyle modifications. Going back to probably 2 decades, 20 years ago, when I started the medical school, there was this view that if you are diagnosed with cancer, so it's better to sit and relax and try not to be active. Unfortunately. But we see, more and more evidence is coming out regularly that's showing the importance of physical activity and being physically active on different cancer outcomes. And I would like to ask Francesca here. Now, you talked about diet, but I would like to ask about your opinion for physical activity and how does it affect, the outcomes, and also, is it something that you recommend to patients who come to you?
Yes, absolutely. And sometimes physical activity can help with some of the symptoms people are experiencing, like loss of appetite, nausea, constipation. Fatigue is a really big one that physical activity helps with, and can help with sleep as well, which sometimes people their sleep gets a little bit messed up. And I always say it's one of the biggest catch-22s with like the lifestyle modifications, because I think it's one of the hardest things to start when you're already not feeling well and you're already stressed and you have now your normal life responsibilities to take care of, and then also your medical appointments, your medications, all of these other things added in. But I think that is one of the things that really helps the most. So that's where it's like a tough one to get into. But I push people to start as much as possible, even if it's a simple 5-minute chair yoga video on YouTube, or a 5-minute walk around their house, or stretching in bed. there's just so many ways to get active, or like an arm bicycle you could put on the table. There's just so many ways to get active, and start small. Nothing is too small, and you can always build on that.
Thank you very much, Francesca. So Joel, I know that you're a tennis player. So I wanted to ask about, especially when you talked about the pain that you had and, practically. So I want to ask about your experience, how what you're dealing with this pain, and then you might be told to only do physical activities that your body can tolerate. So I want to ask about your experience. Did you keep up playing tennis, or did you change your physical activities?
For the first 4 months when I had not hit the stage of I'm going to win the battle, I never thought I'd pick up a tennis racket again. I never thought I would really do anything physical again. And I'm sure the experts on this panel would say there's got to be a correlation between my despondency and depression and sadness and the lack of doing anything physical. 4 months into it, I decided to pick up the tennis racket and beg somebody to go out and play with me, even though I'd probably only play for 5 or 10 minutes and not be anywhere near what I used to be when I was a pretty good tennis player. And I started it, and literally that afternoon I felt better. And I do suffer from significant fatigue and lots of pain from all the bone cancer I have. But I found that the more that I played and got out there, and I am pretty competitive, the better I was able to play, the better I felt, the happier I was. So for me, playing tennis and then later playing golf and now taking long walks and using my Peloton treadmill, for me, the more I pushed myself and did the physical exercise, the better I felt physically, the better I felt mentally. And I think it's been a major component of me so far surviving year 3 into my stage 4 diagnosis. So much so that my oncologist, I asked him a question: with bone cancer, I am very likely to have fractures because my bones are very weak. And he looked at me and he said, Joel, he said, the benefits that you get from playing tennis, if you're careful, outweigh the risk of breaking a bone, and you need to do that. And look at you today versus where you are 2 years ago, and it makes a mountain of a difference. So keep doing it. So yes, I think physical exercise, whatever it is, even if it's taking a walk and just looking out and seeing the sun and the birds and the trees, it's important. And the more that you do, the more you're going to feel better about yourself in dealing with this disease.
Thank you very much, Joel. So we have a question. Patient was asking, is there research showing that physical activity after you're diagnosed with cancer that affects the recurrence of cancer? And just very short, I would like to say, yes, there are some evidence. And the recent one, the most recent one was like an article was published, a paper was published 2 months ago. And well, it was in colon cancer, but also there are evidence for other cancers that showing patients who keep doing physical activities, of course, depending on what their healthcare physicians recommended them, and the amount and intensity. But those patients, it was 1,700 patients followed for 6 years, and then during the follow-up, the study showed that they have lower risk of cancer recurrence. Particularly in the first year, the risk was much lower. So there is this type of evidence. And touching on what Joel just said about the mental well-being and the mental, importance for mental health, Chris, what do you recommend for? Is there any recommendations for people with cancer, and is there any evidence that showing the importance of physical activity on mental health?
Sure, definitely. A lot of studies have shown that physical activity can improve emotional symptoms and also can enhance cognitive function. And as we already said here, it also can improve some treatment-related side effects, including fatigue. So, and we are now seeing a lot of benefits of this type of physical activities among patients with RCC receiving immunotherapy. So I definitely recommend to our patients to practice more physical activity. And if they have any issues, to talk with their healthcare providers or also with a coach specialized in this subject to better guide these patients through in order to do a safe version of this physical activity. So it's really good. We are seeing benefits for anxiety, depression, and also for fear of cancer recurrence or fear of cancer progression. It will definitely improve your quality of life, and I think you'll enjoy a lot. Thank you.
Thank you, Chris. Thank you very much. So another topic, the last topic I think I would like to move on is the psychosocial support. We know that when fight against cancer is really not just the physical fight, but it's also psychological fight and mental fight against cancer. So here we have a question from the audience saying that kidney cancer affects more men than women. In many countries, men are very reluctant to see a therapist, seeing it as a sign of weakness. What can be done to help men with kidney cancer see the value in getting counseling support? So it was asking about men, but I think it's also about many other people, based on the position, the culture, the work we do. And Steve touched a little bit about this point, a very, very interesting point. So Steve, I want to ask your experience specifically. You talked about being a senior manager, and also many you were supervising many people, and also about your work as working in security. So it's a work for tough people. You don't want to see weak. Do you think that having psychosocial support was helpful? And first, I want to ask, despite all these challenges, how did you seek help from counseling?
Yeah, thanks, Maddie. For me, it was a three-pronged attack. There was the medical side, there was the peer support side, and the counselling. Now, on first diagnosis, I didn't have that peer support, so it was only the two. And if you'd have asked me a day before I was diagnosed, would I ever see myself in counselling, I would have probably said, you need counselling. But I was signposted to it by a specialist nurse, and I thought, well, there's nothing to lose, let's go and give it a go. The first session, I sat there and wondered what was going to come out of my mouth and what I was going to say. But when you're in that room with a trained professional, somehow you just start talking. And I found it such a safe space and confidentiality, knowing I could really open up to things that I didn't want to trouble my wife with. I didn't want to trouble my parents with. My concerns around my children growing up and that side of things. And unfortunately for me, while I was going through counselling, I had some real problems with my employer. So much so I ended up down a tribunal route. So that meant I needed a new career. So I had a light bulb moment in the counselling session. In one of them, I thought, actually, I can help with this. I can help people as I'm being helped. And I started doing little introduction courses, finding out what counselling was all about. And I absolutely loved it. And that sense of giving back, I don't bring my story to the counselling room. I keep that for the peer support. But I know I can provide that ultimate empathy and understanding to a patient who comes to see me. And I suppose it gives me a little bit of a buzz now to be able to do that for somebody else, as somebody did with me. If we think about, there was one counsellor in that room with me at my lowest point, I'm now the person in the other chair, and I will be forever grateful for that one person for me. So I want to be that person for somebody else. And it is so important for somebody to have that space. And that's all it is at times, a space to talk about how you feel.
Thank you very much, Steve. Joel, do you want to also share your experience? Have you been to psychosocial counseling, and what is your experience with that?
Before I had stage 4 cancer, I would have been deemed to be, by others and by myself, the last person that would ever seek therapy or be on antidepressants or anti-anxiety medicines. I'm a guy, I'm strong, I'm tough. I raised 3 daughters, let them deal with it. I don't need it. And I got this diagnosis, and I soon realized that the emotional side was harder for me than the physical side. And I think many would agree with that. And I had to figure out very quickly that while I think I have a chance of getting through the physical side, unless I get some help on the emotional side, I'm in trouble. So I took advantage of palliative care and saw a therapist, and she was fantastic. And she's the one who convinced me that you love to write. So why don't you write down your stories, and which led to a book that I hope has helped other people. It's also forced me to live by the things that I say in that book, which in and of itself is a very, very helpful thing. But long story short, I'm 2 years into it, and I see a therapist, and I am on some anti-anxiety drugs. And I'm still very hyper, but less hyper than I always was. But they've been tremendously helpful. But going back to your original question, what we men need to do is let other men and others know that getting help is a sign of strength and not weakness. Because in many countries, in many cultures, it is deemed to be weakness to get help, when the reality is we need it equal to or even more than the very strong women that I've lived with and been associated with my entire life. So I count on the Steves and others that are dealing with this to let the world know that getting therapy and getting medication is strength, not weakness.
Exactly. Thank you very much. Chris, do you want to add anything on that?
Sure. Yeah, I would say that we have some counseling programs specifically tailored for men. So we have seen that men usually tend to adhere to some types of counseling, and we have also the online and remote counseling options, which have assisted a lot of patients. So I would say to our patients to please talk with your healthcare providers about this subject, and also try to understand exactly which type of resource your hospital has, and or if you are not able to achieve enough information at this at your own institution, you can also reach out the support group. IKCC has a lot of options to better inform our patients and also to better guide them throughout this process.
Thank you very much, Chris. Thank you. We have a question here, our final question, that was asking, saying that when looking for information on treatment, side effects, and on the internet, I think that a lot of people do, as well as ourselves. So it's very easy to find information that may be depressing and may not even be true. What are the panel's thought on when and how to use Google and when to avoid it? So probably Joel, let's start with you, because when we are diagnosed with some conditions, cancer or other conditions, the first thing many people do is just to Google it. And you might find, some frightening information. So what do you think? What is your advice on this?
Well, I'm human, by the way. So the second that I found out that I had the diagnosis, I went on the internet and looked at everything, and it scared the heck out of me. And my entire family did the same thing, even though everybody told us not to do so. And it would be foolish to suggest to people listening, don't go on the internet. However, it would be sage advice to let them know that when they do go on the internet, they need to appreciate that it's very easy to put things on the internet. The data is often old, plain out wrong, or misleading. And that the best way to use the internet, if you're going to go that route, is one, to look for independent academic studies at reputable hospitals and associations like this one. Number two, use it as a tool to arm yourself with questions that you can ask the medical team that you trust, or the Facebook communities that you are active in. But number three, most importantly, do not take what's on the internet as gospel. It can take you down a rabbit hole that is very hard to get out of. So for example, when I was first diagnosed, the statistics said that I had a 13% chance of survival. Well, I didn't realize that was an old study. I didn't realize it was before immunotherapy that has lifted those same numbers for people like me to over 50% in some studies. And I also didn't appreciate that no matter what these empirical studies say, I am not a number. They don't know who I am. They don't know how old I am. They don't know my healthcare. They don't know what I'm doing. And I have learned and try to teach other people, be very, very, very careful what you see on the internet. And again, just use it as a piece of information to get the real information from the experts.
Thank you very much, Joel. I echo what you said. It's really important to go to specialized agencies or organizations that the work is science, and they give you these numbers. And I can emphasize, because when we're talking about, for example, survival, or after that, we are talking about human beings, right? It's not just number. It's not just like, for example, kidney cancer. These people, each one has got some, like their diet, the physical activity, the environment that they live in, smoking, all these things, besides the treatments, the availability of treatments, and all these things can really affect these things. So say finding just one sentence saying that, okay, you have the chances of living this percentage after 5 years, it's really something that you need to be careful about. So I want to ask Francesca, do you have any advice for this type of information? Well, because we see that for nutrition a lot, like saying that if you eat that, your cancer is gonna be treated, or all this type of information. So I would like to hear from you, please.
Oh yes, the nutrition information on the internet could be really out there. What I always say is I can't stop people from Googling, and I don't want people to feel embarrassed for Googling or considering what they see on the internet. So I always tell my patients, at least, whatever you see, bring it to me. We can look at it together, and I can help you understand what I'm seeing, why I'm having questions, why I'm having red flags, so that they are better armed when they're going on the internet. Not everyone is really savvy with medical information or nutrition information. And so we can work through it together. And I don't want people to feel ashamed that they believed something that is, totally out there. So that's one thing, is like, bring the stuff to your medical teams. And then for medical providers, we really should be supporting patients to do research. We shouldn't be like just saying, don't do research, it's all bad, you're going to find something crazy and it's not worth looking at. So that's one side of it. And the other side of it is like some of my tips that I do give them when we have this conversation is look for a name. If someone's not putting their name on a video, or their face or their name on a video or article, that's a red flag, because you should say, the doctor's name. If someone's saying something reputable, they should put their name and their face on it. They should be citing their sources. Are they trying to sell you something in the place that they're giving you information? That's another red flag. So kind of, and then the other thing is that now with Google, I mean, sometimes some of my favorite resources will never come up in a Google search. I have tried a million ways to make it be the first result, and it's never the first result. So you really have to search hard to find these things. So I would say, like, it's okay to Google search, but you could always start with your medical team on the other side of that, get resources, and then start searching from there if you do want to like do your own reading and research from there.
Thank you very much. Great advice, Francesca. So we are near the end of the World Kidney Cancer Day Symposium, and well, the title was "We Need to Talk About Living with Kidney Cancer," and we certainly did. And we covered a lot of topics, and I hope that the audience, people who see that patients with cancer, caregivers, and all have picked up some points that is useful for them through this journey. And now, one final thing I would like to ask all panel members: if I come to you and I said I've been diagnosed with cancer and I'm afraid, I have anxiety and all these fears, just very briefly, I would like to ask for, one or two advice that you would like to give to these people. Probably starting with Claudia.
Thank you, Mari. So I will say to be open with your family and friends, because they can be a great source of support, both on an emotional level, but also on organizational level. To reach out to Kidney Cancer Association. They can be a reliable source of information. They can be just a phone call away or an email away. And they can put you, usually these associations have a scientific committee inside of it, so they can put you in touch with the leading doctors in that field, and to take seriously the multidisciplinary aspect that we have mentioned today of the disease, so nutrition, physical activity, as well as emotional, psychological well-being.
Thank you very much. Steve?
Along the similar sort of lines, I would say is be kind to yourself in whatever you do. You're going through enough physically, so be kind and talk to others. Don't do it alone. It's not something to be recommended to do this on its own. You need the support, you need the help. So talk about it, counseling, talk about it, peer support, talk about it, nutrition, talk about it with your medical team. And as I say, I've said it once, but be kind to yourself.
Thank you very much. Francesca, please.
I always say that the one thing we can never put in a pill or an IV is good social support. You will never get a prescription for that. So what Steve said, use your resources, your friends, your family, your community. That is the most invaluable resource you have. And honestly, besides the nutrition kind of stuff, it's like enjoy life, have a laugh, have a smile, like focus on the good stuff, because there's a lot of things that are not great in a lot of lives, cancer, other things. But our perspective and our attitude can take us pretty far. So it's very important, your attitude and the people in your life.
Thank you very much. Chris, please.
So I would suggest to reach out for emotional support from friends, family, and also support groups, or even a mental health professional. Remember that sharing your feelings, concerns, and fears can provide a sense of relief, validation, and also empowerment. So take care of yourself. Thank you.
Thank you very much. And Joel?
I would tell people that kidney cancer is not a death sentence any more than being born is. I mean, we can't avoid death at some time, but there's no reason why those of us with kidney cancer can't live quality and prolonged lives. I would tell people to stay strong, hopeful, courageous, tenacious, keep that sense of humor. And finally, I would let people know that you shouldn't aspire to just survive with this disease. You should aspire to thrive with this disease, like many have and many will continue to do in the future.
Thank you very much, Joel. Thank you. Wise words, and thank you everyone for sharing their experience and expertise. And I very much learned a lot and enjoyed this symposium. And I hope the audience, patients, carers, healthcare professionals, family members, everyone who is dealing with this issue, I hope they also learned from this event. And on behalf of the International Kidney Cancer Coalition, I would like to thank our panel members. And also, I would like to thank our sponsors, the sponsors of this event. Without them, World Kidney Cancer Day wouldn't be possible. And most of all, I would like to thank the audience. Thank you for joining us. And please feel free to share the link for this symposium with your friends, family members, patients, and wherever you are in the world. This event will be translated in several languages. And don't forget, we need to talk about living with kidney cancer. So this is important to share and to go through this journey with other people, sharing what you feel and learning from each other. So please don't end the conversation here. Really, let's talk about that. So thank you very much and have a great World Kidney Cancer Day. Thank you, everyone.
Thank Thank you. Bye-bye.